There is help, there is hope. Hello, and welcome to another episode of Hey Cousins, hosted by Peaches from Peace, Love, and Light. Believe in yourself and all that you are. Know that there is something inside you that is greater than any obstacle. If you or someone you know has talked about or contemplated suicide, please call 988 and get help today. Hope is a 5-letter word. As a noun, it is defined as a feeling of expectation and desire for certain things to happen. As a verb, hope is defined as a wanting for something to happen or to be the case. Chances are, if you were to conduct a 10-person study to define what hope means, you would likely end up with 10 different definitions. But during the month of September, the word hope has just one meaning. For many people that are experiencing suicidal thoughts or ideations, hope means having faith that there is a better tomorrow ahead. When most people think about September, they may think about fall colors, pumpkin spice, and cuddling up to a warm bowl of soup. But for families and friends that have lost a loved one to suicide, September is a time of remembrance. In 2008, September was declared National Suicide Prevention Month, and since then, it has served as a time to remember individuals affected by suicide, to acknowledge suicidal thoughts, and to connect individuals with suicidal ideation to community-based treatment and resources. According to the Center for Disease Control, more than 41,000 people die by suicide every year, an astonishing number that makes suicide the second leading cause of death among people aged 10 through 24 in the U.S. Suicide is the 10th leading cause of death among adults in the U.S. So what can be done to prevent these untimely losses? Spreading awareness of the signs of mental health crises is one of the most important steps in reducing the occurrence of suicide. Anyone, regardless of age, gender, race, or background, can experience suicidal thoughts. Despite how common they may be, these types of thoughts should never be considered normal, and anyone experiencing these type of thoughts should seek help immediately. Of course, 988 First Call for help is a great way to get assistance locating additional resources in your area. There are a few additional warning signs that we should start to become familiar with, since some of them may be subtle and hard to recognize, such as impulsive or reckless behavior, aggressive behavior, increased alcohol or drug consumption, dramatic mood swings, and withdrawal from friends, family, and community. According to the National Alliance on Mental Illness, there are a few additional factors that may put an individual at higher risk of suicide, including prolonged stress, a history of trauma or abuse, a serious or chronic mental illness, and access to firearms. If you have noticed any of these symptoms in yourself or someone you know, offering your support could help to save a life. Be patient. Don't try to argue about whether or not suicide is wrong. Talk open and honest, but avoid raising your voice or making threats. It may also be appropriate to ask if the individual has made a plan or attempted suicide in the past. This will help you determine what resources would provide the best support. Ultimately, a mental health professional should always be consulted when any of the warning signs are present. Luckily, suicidal thoughts can be treated with stress-reducing techniques, coping skills, and in some instances, pharmaceutical therapy. A psychiatrist, therapist, or other trusted licensed mental health professional will help you decide which method of treatment is right for your individual needs and circumstances. There is no need to suffer alone. Suicide is not the answer. With the right support and resources, there is hope, hope for today, and hope for a better tomorrow. Thank you for tuning in to another episode of Hey Cousins, hosted by Peaches from Peace, Love, and Light. This show is sponsored by Sean Lee Jones and the Creative Healing Foundation. Make sure that you subscribe to this podcast to stay up to date with the latest and exclusive content, and if you would like to continue the conversation, leave your thoughts, questions, and concerns in the comment section.